Hello, and welcome to Module 6 of Advanced Statistics in Healthcare, Defining an Endpoint. In Module 6, we will talk about how to define the endpoint of a project or decision-making process. We will discuss how to know when you have done enough, as well as how you can use different types of technology for tracking purposes. We'll also begin to discuss what goes into determining an optimal decision. How do you know that the choice you've made is the best one? How can you set the stage for success? The first thing you need to do in order to determine an endpoint of a project as part of the project proposal is to define what you will plan to track as part of the project. If you don't know what you are tracking, you won't have anything to compare the end result to. Part of deciding what to track is figuring out what type of tracking measures you are looking at. Is it a measure of project success or a measure of deliverables? You want to use these two categories to look at every variable you are planning on tracking as a measure of the project being complete. Most of the time, the type of variable will tell you what category it will fit into best. Variables around the project are usually binary or discrete in nature. Is the project complete? Yes or no? Was it on time? On budget? Did it accomplish the goals listed in the proposal? The results of the project variables are generally easy to measure, as they are either are or are not. Variables that fit into the deliverables category have a bit more to them. These are variables that you look at continually as a measure of the project's outcomes sustainability. Usually, these variables are continuous in nature, and we tend to review them over time as a measure of continued success. These are the variables that we usually think of as tracking variables. These variables are often complex variables and should have a definite plan for measurement associated with them. The variables that fit into the deliverables category are often thought of as being difficult to determine and adequately define. By completing an in-depth project proposal and identifying your measures, you should be able to identify variables that can easily be tracked and show a project success. If you think about the different aspects you need to consider when putting together a good project proposal, you should have a sense of what you might be able to track as part of the project success. The variables that fall into the project category are generally required to be answered a single time, and as just mentioned, are binary, so they are easy to see. The variables that fall into the deliverables category are things that you've already identified as measures you will be reviewing during the project, so you should be able to seamlessly translate them into variables for project tracking results. Think about what you can track regarding the value the project is bringing to our major customer groups, both internal and external. You want to look not only at the initial rate of investment of the project as it is immediately completed, but you also want to plan to check the ongoing rate of ROI. Are there any measures around quality that you might be able to review as a part of the tracking process? Think about how you can track the consistency with which a project meets expectations, now, in a few months, and even possibly a year down the road. Don't forget that the different customer groups may have different expectations and therefore different definitions of quality. What about documenting innovation? You can identify not only that you may be the first to suggest a particular change or propose a unique solution, but you can also track adoption of the results or new processes across departments and locations. This can be a way to track innovation. You can look at how information that is gathered as a result of a project's efforts remain available and is utilized. You can also track the flexibility of the project's deliverables. How well can they adapt if circumstances change slightly, or even greatly? Can different options be available or built in? How flexible are the tools and measures that the project determines should be implemented? By identifying at the outset of the project which variables and measurements you plan to track as a part of the project's success, you can make certain that the baseline measurements are taken and documented in order to show the impact of changes you have made. Of course, in order to track anything and determine if a project will be successful or sustainable, you will need to plan the data collection for after the project itself is completed. Many of the methods that can be used for data collection after the project is officially completed are similar to those that are used for collecting baseline data and data during the project. Observation is one of the easiest to use, but can be difficult to ensure the validity of the results. This is mainly due to the fact that people often change their behavior if they know they are being watched. Hence, the historical use of the secret shopper to see what employees are actually doing versus what they say they are doing. Think about hand washing as an example. Most people, if asked, will say they wash their hands frequently to prevent the spread of cold and flu virus. When observed by a secret shopper equivalent, many people are not washing their hands frequently nor thoroughly. Documentation is another fairly easy to use method of tracking. If the project requires changes to documentation, maybe a particular type of note template is added into the EMR, you can pull up information about how often that note is being used and the results it has on other project deliverables. Documentation is also a great way to track long-term implementation and acceptance of changes made by a project. If you create a regular timeline for checking on the sustained changes, you will have documentation to better show the impact of the project. Tagging or tracers are often a method that is used if the information that is needed from a tracking standpoint is not easily available or directly observable or obtainable. Adding an electronic tag, such as patient ID number, similar to a primary key, can allow for traceability when tracking changes in a process. This can also be utilized for situations in which a deviation from the process occurs and the root cause needs to be found. Pattern searches can often be a way to track the outcome of a project and determine the project's success. You can use the project baselines as a starting point, along with a case study, to determine if there have been any changes, either positive or negative, as a result of the project's outcomes. This would be a great way to look for unintended consequences that may be a result of the project. Again, these can be both positive and negative, and doing pattern searches within the data can help to find these possibilities. You can use a mashup of multiple methods to determine the best method for tracking a project. Maybe you use observations to see if a particular group or providers or nurses is utilizing the new documentation methods. You can then use documentation to show improvements over time or tracers to follow records through the process. Pulling multiple methods together to provide an overall picture of the project implementation results is often referred to as a mashup, as you are mashing up different sources to create a picture. Additionally, you want to make sure that you have reviewed a method to create a timeline for tracking. What is the frequency with which you are going to determine project success? How long does the success need to be sustained to achieve the required ROI? Well, different measures require different tracking timelines. For most projects, a combination of these methods is required in order to provide the documentation of the deliverables for the project. And, as before, determining the methods at the start of the project can help you to obtain valid baselines and document impact and results. You may be wondering why we might be talking about predictions as part of a lecture on completing projects, but often projects that are initially successful might not get the support to have this success sustained. By predicting what a project's success would be if sustained, you can maintain support for any changes or improvements made. Waiting until the initial excitement of a project's completion dies down can result in more accurate data for predicting final outcomes. So revisiting predictions can make sense for those projects that need to have a sustained process change for success. In choosing a prediction model to use for tracking project success, you want to make sure that you are aligning the model with the type and amount of data you are planning to collect. If you're looking to determine if a project outcome variables and measures have an effect on something, or an interaction with other variables, you might choose regression analysis. Regression can be useful in situations where you have several variables that you are interested in tracking simultaneously. Remember, regression can be adapted to predict binary outcomes, time series, or survival rates. An ANOVA is a good choice for those situations in which you are just concerned with whether or not a change made a difference, not necessarily with how much of a difference. ANOVA is also good for comparing before and after situations. It can help you determine if a detectable change is statistically significant or not. Once you have some initial results collected from your tracking, you can use a Monte Carlo simulation to help you predict longer-term impacts. Remember, with any of these types of prediction methods, more data gives you more accurate prediction. Thus, having at least some of the initial results can help you to increase your accuracy with longer-term predictions. As more tracking data is obtained, it can be added to the model, giving multiple updates to the predicted project's outcomes. If your data are not numerical in nature, but you are tracking things such as perceptions or opinions, you may want to use an aggregation model to help you predict final or sustained outcomes from project tracking data. This type of model can help you to limit the influence of extremes of results that can occur in these types of data. Qualitative data can be compiled to track and to show success with, and an aggregation model can help. Aggregation models pull together individual results into a group of data that is looked at together. This is the type of model that is used when you hear results such as 80% of PCPs are now using Note Template A and feel that it is helping them in their daily patient chart updates. You may have one or two PCPs who hate using the new template and feel that it is making their updates worse, but by aggregating opinions, you will be able to better focus on what the group thinks and make adjustments based on the larger set rather than trying to please one or two people completely. Regardless of the method chosen, you need to constantly be considering the usefulness of the outcome measure and the predictions of success that it is giving you. The definition of useful, as given by the Oxford English Dictionary, is to be able to be used for a practical purpose or in several ways. From a phrasal definition, useful implies that the item provides value and benefit in some ways. Think about what you have learned about the different types of value, from value to the customer to value to good data analysis and explanation. You need to be able to show the benefits as much as you do the risks and the costs. As you complete a project and look at defining what will be tracked and when, you need to also consider the useful life of the outcome measure. How often have you continued to report on a measure that it no longer has meaning because no one ever actually decided the continuance of the measure was not useful? Understanding when compliance or success is reached and is considered sustainable is a key part of tracking outcome measures. Any good project will not only define what the outcome measures are and how they will be tracked, but will also define how long it makes sense to continue the tracking. After the time period is completed, a new evaluation can be made to determine if it is indeed necessary to continue the tracking. If the decision at this point in time is to continue again, a defined time period should be determined. Much extra work could be reduced if we only track things that are considered to be useful. Applied Information Economics, or AIE, is a term given to the entire process of identifying measures and assigning value and risk to them. Most of the time when we hear the word economics or economy, it is automatic to think immediately of money. Another definition of economy is the careful management of available resources. It is this second definition that I feel fits the best in the healthcare field. Resources can be not only financial in nature, but can also be knowledge or personnel based. Applying information in a manner that helps to provide for the best management of all available resources can help you to ensure that you're making the most of those resources in the best ways possible. If you think about the major steps of putting together a project proposal, you are essentially applying information that you've gathered thus far to a problem or situation in which resources may not be used in the best possible manner. You need to start by gathering the needed information through doing a preliminary analysis, or at least some initial research. This can help you to determine what exactly the business need is, as seen by your multiple customer groups. Information gathering may include data mining, observation of processes, or even interviews with individuals who may be key stakeholders in project. You also want to try and determine who might be considered an expert in the area the project will include and cover. Experts can be someone highly regarded in their field, but can also be frontline administrative staff who have an up-close view of the process or situation. Once you have the initial information gathered and have determined that there is a need for a project in a particular area, you will have to begin by creating a specific definition of the problem. This will require the necessity of talking to as many customer groups as you can identify to ensure that you understand the needs of each and to understand how the problem or situation is defined by each. Once you have a detailed definition of the problem that the project is going to address, you can begin to determine how to approach and address the problem from a step-by-step basis. This is the point at which you use your preliminary analysis results to determine the different criteria and factors that should be a part of the project. For each of these, you want to consider how you might go about measuring them and try to determine at least a preliminary estimate of outcomes to see if the need will actually be addressed by the project. After you've determined the business need and defined the situation or problem, you can begin to look at measurements. Think about what each outcome measure option can give with regards to the value of information. How can these measures reduce uncertainty around the outcome, the value, the risks? You want to try and match each outcome measure with the best method of measurement for that type of situation. You've learned several methods over these courses. Consider all of them to determine the best combination of methods for your particular situation. You also want to make sure that you are identifying not only the value of the project will bring to your customer groups, but also identify ways of measuring the potential for risk. How can you determine the trade-offs that may occur both as a result of doing the project and as a result of not doing the project? Once you have all the items in place for your project proposal, you want to create a final recommendation for the project incorporating all the information gathered thus far. You want to use your preliminary analysis to show the business needs, as well as to explain how the project will show value on multiple levels. You want to make sure that you've addressed the possible risks and identified what can be done to alleviate some of the uncertainty surrounding those risks. You will need to have identified both what outcome measures will be used to determine the project's success and how you will go about tracking those measures. It isn't enough to just identify outcome measures. You need to propose a method of tracking measures so that you can determine project impact and success. This will also provide a way to determine when your project is actually complete, rather than just continuing on indefinitely. For any project that you undertake, the plan is always to succeed, with sustainable results that have made an impact on the customers. In order to know when you have succeeded and how you know when to stop tracking improvements, you need to understand what success actually means. It is different for everyone. One of the challenges with defining the success of a project is the difference of opinion your multiple customer groups can often have. What may be considered a success by the patient may not be by the provider or the agency. Or, alternatively, what might be considered successful by the staff and the patients may not be for the agency. You may also encounter this when looking at success from both internal and external perspectives. You may need to balance ideas of success for multiple customers and determine which definitions take priority and which may need to accept a lesser success. As a part of understanding what success might mean to different groups, you want to look at your project outcome measures not only as either project or deliverables, but you also want to consider another type of categorization, whether the measure itself is a criterion or a factor. The Cambridge Business English Dictionary defines criterion as a standard by which you judge, decide about, or deal with something. A factor is defined as one of several things that can affect or influence a situation. Take just a moment and consider how these two definitions, although similar in nature, describe an outcome measure in two different ways. An outcome measure that is a criterion is one that is judged against some sort of standard or baseline. This may be an actual baseline taken as part of the process, or it may be an expectation of the customer based on past experience. Criteria tend to be a bit more subjective in nature, as they are comparing results to a particular standard. An outcome measure that is a factor, in contrast, is looked at in how it changes or influences a situation. This might be a process, patient satisfaction surveys, or even perception of the care your facility provides. A factor isn't comparing the results to a standard. Rather, it is looking for a change from the current situation. The change could be positive or negative, but may not necessarily have a specific target as a criterion would. In considering the success of a project, it is very likely you will end up with a combination of these two types of success measures. Some measures will be better suited to some customers than others, and often customers will tell you their preference for what constitutes success. As they do, you will want to keep in mind these two definitions so you are not trying to show a type of success that does not fit with either expectations or the outcome measures chosen. Let's consider a few well-known building examples to emphasize the importance of knowing the definition of success. First, we have the Sydney Opera House in Sydney, Australia. Today, this is a well-known landmark that epitomizes not only Sydney, the city, but has become a symbol of Australia as well. When it was first built, it did not have quite as rosy of a review. The project took 4 times longer than originally planned, and ended up using 6 times more money than the original budget. Many felt these were great obstacles to overcome. If we consider the impact of the Sydney Opera House on the multiple customer groups that would have been a part of the project's outcome, most people don't remember the timing and budget issues at all. In contrast, there is the Millennium Dome in London. It was built to house a major exhibition that showcased at the start of the 21st century. The project came in on time and on budget, but is considered by many to be a failure of a project. Although it is a very recognizable structure, what to do with it after the exhibition was over was not thought out well. Not much consideration to sustainability of use had been given. Additionally, those in charge of the estimation of visitors were considered to be unrealistic in their initial projections and did not revise estimates as data became available once the dome was open to the public. This caused the operation of the dome to run into significant financial difficulties early on. Unlike the Sydney Opera House, the Millennium Dome did not have the impact expected. It did not meet the expectations for success by its customers. As you decide what outcome measures you will use to measure the success of the project and the levels with which those measures must meet to define success, there are a few things to keep in mind. First, you want to make sure that your customer groups and stakeholders are able to clearly understand the outcome measure and the goals that are set. You need to be prepared to deal with the potential for a misinterpretation of both the results or the expectations. You want to make sure that you have considered the expectation of all of your groups in order to ensure that you are able to balance the expectation of the stakeholders in the project. One key driver of project success, particularly for those projects involving process change, is a willingness of the customer to not only adopt the changes, but sustain them going forward. Discussing these expectations and their reasons can be a great way to make sure everyone's expectations are starting from the same place. You want to make sure that you are measuring both project and deliverables and tracking them appropriately. You also want to make sure that you know the expectations for the project one-time measures so that you are able to check those off when the project implementation is complete and can turn your focus to the deliverables. Something to remember as you are working to define the outcome measures and their success levels is you want to set realistic levels and make the goals to meet, not exceed those levels. This is particularly true if you're dealing with a large number of variables. Concentrating on exceeding a few often results in negligence of the other tracking mechanisms, which can result in poor customer satisfaction with the overall project outcomes. All of what we've covered thus far in this lecture and in this course can be seen as learning tools that can help to reduce uncertainty. As discussed many times in the past, any reduction in uncertainty can give you a better idea of whether a project will be a success. As a part of that, as you begin to track project results, you will want to use the new information to help you continue to refine your predictions and improve the forecast for success.